Good evening, doctors. Hope you all are well and doing practice. Diet 3 ongoing, diet 1 candidates already selected from the passage-wise cases. So we'll do today long clinical case consultation. So from my voting, first it was Dr. Afshin Javaid. Is he here to able to participation?
Yes, I'm here. Yes, I'm here.
Okay. So, Dr. Afshin, today your clinical consultation, long clinical case, as I follow always exam. So before starting, you'll get 3 minutes for your preparation for your format instruction. Then it will be given the feedback according to real exam. Then the case will be discussed. Is it fine with you?
Yes, it's fine with me.
So I'm starting and I'm giving you 3 minutes for your preparation. Thank you. So time is start.
I don't have the case yet.
Okay, you can check your net issue.
Doctor, I can't see the case.
Time is stopped. Is that visible for all of candidates? Long clinical case?
Yes. Yeah, we can see.
Yes, it is visible.
Yes.
So, Dr. Afshin, you can check your nets, your site, because is it visible for all of candidates?
Just give me a second.
Your timer stop, no issue. You can take time for fixing your net connection.
I'll just, join.
Time is started. Case started. So let's start.
Okay. Hello, my name is Dr. Javed. Are you Mr. Adam?
Yes, I am.
Mr. Adam Hager, 45 years of age, right?
Yes, you can call me Hager. It will be nice for me.
Thank you so much. So nice to meet you, Mr. Hager. So I understand we are meeting here today for your complaints. Is it okay if I ask you some questions and then guide you accordingly?
Sure, doctor.
Okay. So I understand you came here with, but before we go in detail with that, can you please tell me, is there any medical condition that you have already been diagnosed with?
Doctor, regarding my medical condition, yes, I am known case of diabetes from my childhood, and also I have asthma.
Okay, I'm so sorry to hear that. And you currently are being managed for these conditions?
Yes, I'm totally okay with this medication, and also with my disease fully controlled.
Okay, and if may I ask if there are certain medical conditions that run in your family, like gland disorders or skin disorders or joint disorders?
No, not like that, doctor.
Okay,
No,
thank you so
doctor.
much. So I understand that you came here for tiredness. Can you please tell me more about it?
Doctor, it's not only tiredness, also I have dizzy feelings for last 1 week, which is bothering me a lot, and I'm very much afraid what is ongoing to me.
Okay, so so this has been going on for 1 week. Has it stayed the same or has it gotten worse?
Doctor, I believe like last 2 days is worsening, and that's why I presented, because I can't drive, I can't do my work properly, so it's really very much trouble for me.
Oh, I'm so sorry. We'll help you and guide you accordingly. And is there anything that you take or do that makes it better?
Doctor, I didn't get your question. I'm stopping the timer and I'm checking the net connection from your side and my side as well. Thanks. So yes, doctor.
So you said the dizziness and tiredness have been worsening for past 1 week. Can you tell me, did you have any change in medication in this week, or started any new medication,
A new medication, no?
or any changed dose of medication at this point, like 1 week or around that time?
No, doctor. There's no change recently.
Okay. So at what time of the day is this tiredness worst at? Morning or end of the day?
Always, doctor. Always there.
Okay. And have you had any weight changes with it?
Doctor, I noticed that I'm losing weight. I think that it is due to my heavy exercise, so that it can be, but it is not. It is not due to, I think, not for my disease anything.
And
What could be the possibility?
any changes in appetite?
No, doctor.
Okay. And has anybody told you that you look paler?
Failure? I don't know, doctor, and no one told me.
So do you feel breathlessness while you take a few steps?
Breathless? No, doctor.
Okay. So is this, did you have any flu-like illness, like muscle joint pains a few days back before this dizziness started?
Doctor, I don't know what happened, but I feel some feverish at the night.
Okay. So so you have fever and you've lost some weight, and have you noticed any lumps or bumps in your body?
I don't know, doctor.
Okay. Any rashes on the body?
I don't know, doctor. I never see anything like that.
Okay. Any racing and pacing of the heart?
A racing of the heartbeat, yes, doctor. When I try to sit into stand, I feel some racing over there.
Okay. And have you had any frequent infections recently?
Infection? I'm not sure, doctor.
Yeah. Do you have any um, discomfort on adjusting to extremes of temperature? Like, have you been extra cold or extra warm lately?
No, doctor.
Have you noticed any change in your bowel habits?
No, doctor.
Have you noticed any bleeding from any part, like eyes, nose, mouth, or back passages?
No, doctor. I did notice this way.
Okay. So, and have you noticed any change in your waterworks?
No, doctor.
Okay. We'll circle back to some questions. I'll just take a quick look at your general medical conditions. Are you any allergy? Do you have any allergies to any drugs or foods?
No, doctor.
Are there any medications that you are currently on?
Yes, I was some inhaler due to my asthma and some medication. I stopped it, all medication.
When did you stop the medications?
I stopped because I feel okay. I feel it's not need for continue, so I stopped it at 2 weeks back.
And you did you consult your GP regarding this?
No, I think it's okay for me because no need to take any medication.
And that is something we need to talk about because I appreciate that you're feeling better, and I appreciate that you think that you don't need medicines anymore. But it's quite dangerous to leave medications without consulting the GP because they are protecting us from certain life-threatening conditions. I understand that you have diabetes type 1, and that can have some serious complications. Do you monitor your diabetes regularly?
Yes, and my last diabetes was 6.5 HbA1c. You are asking for that. I know very well, and I'm taking still insulin because my doctor said that I can't stop never, so I'm still continuing. It's not a problem, but as I'm fully okay with the medication and the asthma, I feel I don't have any asthma. It was my childhood, but my doctor said always to continue, but I don't feel so.
So, have you had any asthma attacks since you discontinued your medication?
No, doctor. Last 1 year, I don't have asthma, so I discontinued this medication for last 2 weeks.
Okay. And do you have any? Do you get? Do you drive?
Yes, doctor, I do drive.
Has this tiredness affected your ability to drive? Did you ever sleep behind the wheel?
No.
Okay. And do you have a job?
Yes, I have it. I'm a construction worker.
And has this affected your ability to work?
No, doctor.
Okay. Have you had any recent travels?
Yes, I was in last month.
Where did you travel to?
It's around in Uganda in last month in the areas of
Okay.
Uluru, like, yeah.
And did you take vaccines and preventive medicines before you went there?
It's a short trip. I think it's not needed.
Okay. And did you use nets there? Mosquito nets?
Mosquito nets. I was in a good hotel. I feel it's not needed.
Okay. Have you noticed any shivering or chills?
No, doctor, not like that.
Okay. Okay, I'd like to start the examination. At this point, I'll start by looking at the hands. I'll check the tremor,
What you want to see, just tell me. It will be showed and it will be told at the positive finding, doctor.
pallor, clubbing, tremor, muscle wasting, dupuytren's contracture. Then I'll look for pulses. I'll look for proximal myopathy. Then I'll
Okay,
move
one by
to
one, doctor. Proximal myopathy absent, pallor is present, and there's a no Dupuytren's contracture. And you are asking for the anything else? Pallors, Dupuytren's contracture, and there is a proximal myopathy. Only pallor and proximal myopathy is present, doctor.
okay, pallor and proximal myopathy, and then I'll no tremors of outstretched hands.
No tremors. Anything else?
Okay, then I'll move to the face. Any pallor in eyes?
Yeah, I said it is positive.
And in mouth, any any central cyanosis or any growths or any candidiasis, anything in the mouth?
In mouth, there is no candidiasis. There is no central cyanosis. Is anything else? Do you want to see?
I'll also screen for jaundice, like while checking the eyes and face. I'll also check for you said the pulses were normal. Then I'll go to heart. I'll check the I'll auscultate the aortic area and for flow murmurs, and then I'll auscultate the whole precordium. I'd like to go to the spleen, and then
Okay.
I'll come back for cervical lymph nodes and thyroid gland.
Cervical lymph node
Examining
positive.
cervical lymph nodes positive, and spleen is positive or not?
Not.
Okay, the cervical lymph nodes are positive, and he said that he didn't notice any loose stools. And is there any swollen tonsils in the mouth when we examined the mouth? Any swollen?
No.
No, like sore throat or like something like infectious mononucleosis. Look, angry.
No.
Look. Okay, then cervical glands. Then I'll check the. I'll ask the patient what their concerns are.
Doctor, what do I have? Is it serious? What do you think?
After observing and
2 minutes
examining you,
left.
okay, we'd like to do some blood work, and we'd like to run some scans in order to confirm your diagnosis. And we'll manage you accordingly. In the meanwhile, we'll put you back on the inhaler. Is there any other concern?
Doctor, do you think it is like my mother? I mean, my mom has a multiple sclerosis, and I have this dizzy feeling, and it's a very much. I'm so much concerned why this is happening, and why is it this weight loss due to my exercise, doctor? What do you think?
So I don't think this weight loss is due to your exercise. I think this is more probably due to some infection that you recently acquired while traveling, and the glands in your neck are also swollen. And you said you're feeling feverish in the night. So and you have been losing weight. So there could be a number of tests, number of different diseases, but we'll run some tests and we'll manage you in according to the results of those tests. Our first step would be to take some blood samples and get some scans done.
Do you think is it serious? I need admission, doctor, that I have more dizzy feeling nowadays.
We can decide that after because your blood pressure is 110 and 70, so and your fever is not high. So after a few blood tests, and if the results are okay, we might let you go, or we might hold you. But these depend on the results of those tests.
Do you think it is due to stop my medication, which is called steroid?
It could be due to stopping the medication, but it also could be due to something you acquired recently. And we have to run some tests to confirm that.
Your time is up. Thank you. And I'm giving you 1 minute for your full scenario-wise summary. You can take 1 minute for your.
Okay. So Mr. Adam Haggers, 45-year-old male, presented with tiredness. He had normal blood pressure and pulse. On history, he told that he has been feeling dizzy and tired for 1 week, and it has constantly got worse. There is some racing of heart, but he did not have any flu-like illness. The only notable finding was that he has stopped his asthma medications. He's a known diabetic. On examination, there was pallor, and there were positive cervical lymph nodes, and the spleen was not palpable, and there was proximal myopathy. So keeping in mind these findings, I would like to run some blood tests and some scans to confirm my diagnosis. My top differentials will include infections like tuberculosis, malaria, dengue, or infectious mononucleosis, some malignancy that showed up like a lymphoma or any lymphoproliferative disorder. And also I have amyloidosis in mind because the patient has had a long history of diseases, and prolonged inflammation prones you to chronic amyloidosis.
So your differential top is that TB infection.
Yes.
So do you think this tuberculosis causes this disease?
Well, if tuberculosis affects the adrenal glands, they might might make him dizzy, but because his blood pressure is fine, I do suspect that his dizziness is more due to inner ear involvement, some vestibular involvement, or central brainstem involvement, and not due to orthostatic hypotension.
Did you offer postural blood pressure checking, doctor? Sitting and standing,
No.
did you offer it?
No.
If I said it is positive, what more possible diagnosis you want to keep in your list? Tell me.
Addison's, because he was on steroid and he stopped taking steroids, and the withdrawal of steroids can precipitate Addison's. That's a common side effect precipitated by not tapering the steroids and abrupt withdrawal.
So now, doctor, tell me your sequence-wise diagnosis and differential.
Well, because I do not know when I was looking at the mouth if I noticed any
Did you
pigmentation or so,
offer
but
any
my
pigmentation? I mean, if you offer the pigmentation, there is this looking, and the hyperpigmentation area you only said cyanosis, you only said candidiasis. You didn't say any hyperpigmentation area or not. So that they didn't say you, and even you have to offer the torch for the hyperpigmentation. Okay. So, doctor,
okay.
tell me that how you'll investigate.
First, I'd like to I'd like to do a short syntectin test to screen for Addison's. Then I would also run some blood tests for having the baseline, like full blood count, ESR, CRP, some liver function tests, including the clotting profile, some liver function, some renal function tests with serum electrolytes, especially potassium. And then I would also run a urine analysis. I will, if my screening for Addison's comes positive, and then I will investigate in that direction. And I would, because I have tuberculosis in my differential diagnosis, and there are swollen glands. I would like to run some imaging, including chest X-ray, and because he also has like proximal myopathy and gland, so it could be any other. And he has a family history of autoimmune disorders, like he has type 1 diabetes for a long time, so he is prone to other autoimmune disorders.
So, doctor, could you tell me the patient need admission or not?
Because now our top diagnosis have turned into Addison's, we have to admit him, because Addison's cannot be, it's a potentially life-threatening condition. We have to give them steroids, we have to give them IV fluids and monitor them.
Which medication you want to give for the admission?
First would be steroids, because the withdrawal of steroids precipitated. Then we will also give fluids. We will also give, depending upon the electrolyte imbalance, we will correct that, and we will get glucose.
Did you offer your patient for the driving stop, doctor?
I would offer, because now now they have Addison's will they're not fit to drive behind the wheel. I will ask them to stop driving.
Whenever patient telling you I have DC and I drive, obviously you didn't offer, right, doctor? Thank you so much
Yes.
for your participation. Your time is up. So
Thank
now,
you so much.
thank you. Now your judgment according to the case. First of all, I would say, though there's a time, I mean, rather than BCC, it's LCC, it's a 14 minutes. I say, okay, fine. But for my advice, exam candidates, be little bit fluent, because there's a lots of question. Approach, first of all, when you started like I'm your patient, you started with, do you have any past medical history? It's not sounds good. Your patient with dizzy, fatigue, if they start, you can keep it up. I mean, past medical history, drug history, obviously you can keep it up, not for a first question. It's not appreciated. First of all, you have to say regarding the how long, is there an aggravating factor? Is there any relieving factor? How it is started? Is it you later? I mean, you started how? If you say communication marking, communication, I mean, clinical consultation 2, and I mean, communication is a 2. So in overall, in real exam wise, clinical communication, you have to pass very low range. Total 16, you have to pass 11. I mean, it is not a good distance. It's not like it's 28 like differential. If I get 17, I will pass. No. Clinical communication 16, you have to get 11. It's a very short, I mean, it's a very short distance. You have to get maximum mark everywhere. So structure, I always posting my group structure, format structure. You can keep this question up. You can make your format like, okay, fine, I'll keep this question up, but not like first question. Do you have any past medical history? What about your family history? It doesn't sound good. You have some differential. You are approaching this way, appreciated, but the structure I am not appreciating, even though examiner, they will not be satisfied. So overall, I don't want to be a tough examiner. I am giving you borderline, and 2 is a 3. Now, physical examination of whenever you are thinking the dizzy feeling according to a differential additions drug induced. So whenever you giving the torch, as it is our online, it's not offline. So you just see sometimes real patient, there's no fine. It's reality. Drug induced tuberculosis. So some hyperpigmentation appears take time. So it could be normal. So we never do any sign invert, never. No need to do any sign invert. So you should say, I would like to see the any cyanosis, any pigmentation, any candidiasis. So it will be appropriate for you. Any kind of the hyperpigmentation, any other area of the body, it will be appreciated. So it's always, and again, for that reason, I'm giving you borderline. Even if you didn't offer the postural drop, I mean sitting to standing and outside. Even if you didn't offer it, you utter it. So one word is very important. You should offer, I want to do sitting to standing. Also the blood pressure, is then it dropping there. It means you thinking is appreciating, I mean you are thinking according to diagnosis. It's a clinical judgment. Okay. So doctors, overall we know very things, but well structure, why we are losing money, that's the point. Physical examination, if we saw real exam was total 24, I have to pass 16. Many frequent my friends, colleagues, only 1 more distance for the pass. I mean all pass only. It's really very heartbreaking. So that I always say the structure. So if you standardly make your structure in your format, you'll pass. No, honestly. So physical examination, again, I'm giving you borderline, and it's a 2. So identifying physical sign, I'm giving you around 3. Your mark, you missed postural drop, you missed cyanosis. There is a hyperpigmentation only the elbow area, not in the palmar crease. In the eye, if you say in the mouth, in my I keep it hyperpigmentation. If you see the broadly, there's a hyperpigmentation area. Somewhere they may not give, it's a hyperpigmentation area. So physical sign is around 3. Differential diagnosis, you started with tuberculosis, okay, but mainly it is even doctor, I would like to say regarding the drug history. If you say this way, it is acceptable till diet 2 in short communication. Do you have any drug? Do you have this? It's okay, but now you have to say, is there any drug like steroid like that? If you don't utter this word, they never give you a clue, never. So is there any drug like a steroid? You are taking asthma medication. What are the medication? Where in your list? Can you show me your list, please? You didn't ask. So that you miss the mainly the differential only tuberculosis infection. You make your list of differential. I am not satisfied actually regarding the addition. I was giving you clue in exam. Whenever examiner will give you clue, it means it's not good sign, it's a bad sign. Okay, it's reality is reality. Whenever examiner will help you, it's not a good sign. That doesn't mean that they are trying to pass me, never. They're trying to lose your marks, cutting the marks. That's the point. Okay, so differential diagnosis, I'm not satisfied. Clinical judgment, according to my when I'm giving you clue, you say it nicely. So overall it will be 3. According, whenever I'm giving you the hints that it could be, what do you think, this way you just clinical judgment will be 3. Managing patient consult, you do you think it is due to the eye of my medication steroid? You said yes, it could be. And regarding the tuberculosis, you keep it on in mind. But any sick person concern, do you have any cough? You said it's difficult to breathe. Your patient have cough also. Cough for the 7 days. So you didn't ask it. Only your honestly the structure is not satisfactory. So overall, I'm not giving the full mark. It will be around 20 or 22. Any question, any concern, or I'll discuss our case today. Is there any question or any confusion? And I can take the question later according to real exam scenario. So in this, our real exam scenario, it was the adrenal tuberculosis or tuberculosis adrenal gland. It could be other causes, like it could be primary cause, it could be secondary cause. Primary cause, as patient is autoimmune. I'll take the question later. Thank you. So kindly mute the mic. So what I said, that primary cause, it could be the secondary cause. Here, tuberculosis is one of the cause. Secondary, that the patient stopped the medication steroid, or other causes. The Nelson, you have to check, is that a scammer? You didn't, you didn't. It was not your mind actually. Anemia was asked, and the primary cause patient is type 1 diabetes. So as a whole, the DD was like that way in real exam. Actually, it was the case from India. So dizziness for 1 week, sitting or standing, postural drop was present, and patient was traveling Uganda like somewhere, and there is a tuberculosis patient is denied. Real patient denied. Don't have any kind of the sick patient, because I was in a 5-star hostel this way, but I have a cough, I have a mild fever, I have loose weight, but I am diabetic, I am asthmatic. So even diabetic complication, you should say, is there any kind of the complication, like any kind of even autonomic neuropathy, even if you see dizzy feeling, this way this same case they can put in next day, I mean first day, second day, same scenario. This actually happen. Weight loss, changes of the concentration, or patient in the concentration worker, so stop suddenly the start. This is the positive real exam scenario. Second is that you said, yes, I will do the short synaptic, but obviously you have to say the serum electrolyte, low sodium, hyperkalemia. I need to say the blood sputum culture, because patient have cough. You didn't you didn't offer this way. Serum acid first basically for the tuberculosis. Positive finding, doctor, you didn't I mean you didn't check the auscultation, the lungs, so it was minus from your side. You check the spleen, you check lymph node. It is spleen is not so mandatory here. Here mainly the patient have the cough, so that auscultation of the lung was mandatory. You did cervical lymphadenopathy, you did the proximal myopathy, and you didn't do the postural drop or the postural hypertension. And you, even if you are in mind, when you reach the diagnosis, when you are taking the consultation, you should say bracelet. If needed, we'll give the bracelet, because we are starting the hydrocortisone again as patient was stopped, as it is a medical emergency. So as a whole, for in summary of this case, that whenever fatigability, tiredness is DD multiple, according to the multiple DD, always structure, and we should do pass. That's it. Actually, from my mind, always say we have to do pass. How to pass easily? So structure, if we say according to the symptoms present this way, how long, when it started, is it sudden, gradually, is there any aggravating factor, is there any relieving factor? As you asked the family history and a drug history, is what are the drug list you have? Can you show me your drug list? Now, what are the medication? When you start, what are the dose of last medication? Drugs medication list is very important in this case, very much important. But steroid stopping, adrenal TB, this is two major DD here. So you didn't evaluate in this way. So obesity, that you already there's a weight loss is there, anemia is there. There's according to the DD, you have to keep on your list. I just write according to the our thinking. Chronic fatigue syndrome, shrinking, is there whatever the mood, is there any low mood and stress on your life? So approach is in your hand. Whenever you're approaching, think what I'm doing. Patient have type 1 diabetes mellitus, ask other autoimmune disease, pernicious anemia, hypothyroidism, you asked, regarding hypothyroidism, you asked, any kind of the rheumatoid arthritis, joint pain, any kind of the other autoimmune condition, you should ask. You asked already the allergy as well, but as a whole, the long clinical consultation time is more, nicely can present according to the format. So this was my today's long clinical consultation. If anyone have any question, can ask me.
So doctor, this the first diagnosis is what?
First diagnosis is a steroid withdrawal, or second is the tuberculosis. First, steroid withdrawal. 2 weeks ago, patient stopped the steroid. It was first. Second is the tuberculosis. Patient only has cervical lymphadenopathy. That's it. Still, the hyperpigmentation is very mild. It was. Any question? Even long clinical consultation, doctors remember, like it in BCC we said basic. I mean, most appropriately, I'll do short nothing. As it is BCC, you can start from the basic. I'll do the serum electrolyte, serum CBC for the infection. Always, whatever the investigation you are uttering, tell why. Is it due to the infection? Is it due to the checking what? Serum cortisol, why I'm doing so? Always interpret. I'm doing so this, cause this I want to see. Any question, doctors?
Doctor, we
Thank
put
Yes,
put
doctor.
this steroid above of the tuberculosis because if the steroid stopped it, the risk.
Yes. It is first, second tuberculosis. Yes, doctor.
Thank you.
Even if you utter this, it could be steroid withdrawal, it could be TB, you will get full mark. It will not be first, second, it will be full mark. There's no number will be cutting down here. Because it is you are thinking this way, that's mainly appreciated, that's you are getting full mark. So whenever steroid withdrawal is the main and admission is must, and IV hydrocortisone approach of the management is must, multidisciplinary the approaching, always remember presentation is the vital for the long clinical case concentration to get main mark. Presentation, how I am presenting the case, what the first of all, patient education counseling regarding the disease, patient need admission, and after that there is a best alert. We have to continue the medication for long-term steroid as patients withdraw. This way presentation is a very appreciating. Any question from anyone? If no, thank you so much. We are ending our session, hoping all will do practice more. Thank you so much.